Hello everyone, welcome to scardia.com. I'm Hina Khan and today the topic of our lecture is Pathology of Sudden Death. So in the subsequent sections, we'll be discussing the different pathophysiology that is basically the underlying foundation for sudden death. Whenever we are describing or whenever we are defining sudden death, the definition that the WHO criteria that basically encompasses is the death that occurs 24 hours after a serious condition. So 24 hours is basically a time period that we are basically keeping in our mind. But it is, for some pathologists, it is considered quite a lot of time. So they consider it to be 1 hour after a certain serious condition that someone is suffering from. So in the first section, we'll be discussing the reasons of unexpected death. We'll be discussing the sudden death from ruptured cerebral aneurysms, of course. Now, these cerebral aneurysms are basically the birth defects and they remain undiagnosed for a lot of people for a lot of years in their life. So it is an undiagnosed condition for a lot of people. Then we'll be discussing the sudden death in epilepsy after that. Now, epilepsy is basically a condition in which the electrical impulses in the brain are magnified for a very short period of time. So even this can be the cause of sudden death in a lot of cases. And moreover, we'll be discussing the genitourinary system that can also be the underlying cause for sudden death in a lot of cases. In the second section, we'll be discussing the pulmonary diseases in detail over here. We'll be discussing the pulmonary thromboembolism, which can be a cause of sudden death in a lot of cases. Basically, this pulmonary thromboembolism is caused due to the deep vein thrombosis. Deep vein thrombosis is a condition that can arise in the extremities of the body, and sometimes these thromboembolic phenomena occur in the legs of the person, and after that the thrombus basically is dislodged from the lower limbs and it is moved towards the heart or even towards the brain, and that can cause infarcts in the heart and the brain subsequently. That can be the cause of death in a lot of cases. Then we'll be moving on to the asthma and the respiratory obstruction. That can also be one of the leading causes of sudden death in a lot of cases. Asthma is basically an allergic reaction, and only some people are exposed to this kind of an asthmatic reaction. And after that, we'll be discussing the respiratory obstruction. Obviously, we'll be discussing the different modes of this respiratory obstruction over here. It can be an accidental, it can be a suicidal, and it can as well be as a homicidal respiratory obstruction over here. After that, we'll be discussing hemoptysis. Hemoptysis is basically blood that is expected on coughing. So that is basically how you define hemoptysis, and sometimes even extensive hemoptysis can result in the sudden death of a person. In the third section, we'll be discussing the gastrointestinal disorders in detail over here. We'll be discussing the gastrointestinal hemorrhage first of all. Obviously, there are a lot of underlying reasons for this gastrointestinal hemorrhage over here. It can be the tumors, it can be the infections, for example, the chronic infections as the hepatitis B or the hepatitis C infections. All of these infections basically lead to a variceal bleeding. For example, the variceal formation first of all, and that is going to subsequently lead into the variceal bleeding phenomena. Moreover, we'll be discussing the fatal abdominal catastrophes. It's basically any trauma that can lead to a fatal death. For example, any abdominal trauma, as well as it can be a chest or a thoracic trauma as well. After that, in the fourth section, we'll be discussing the trauma, and side by side, we'll be discussing any disease phenomena that correlates to this traumatic phenomena. So it can be coronary atherosclerosis. After the formation of atherosclerosis in the veins and the arteries of the heart vessels, these vessels can sometimes be traumatized, and that will result in a sudden death of a person. We'll be discussing the subarachnoid hemorrhages over here, and moreover the pulmonary embolism, which is one of the major causes of sudden death in a lot of cases. So I hope you want to learn more about the pathology of sudden death. So do watch the other lectures or other sections of this lectures as well.